everyone, I'm Radha Chitale. I'm the KCA's Communications Director. I'm really happy to be here today and talking with Megan Conley. Megan was diagnosed with chromophobe renal cell carcinoma earlier this year, and she had surgery soon afterwards during the early uncertainty of the COVID-19 pandemic. So Megan, thanks so much for being with us here today.
Thank you, Radha. And, I want to first start by thanking Gretchen Vaughn and everyone else at the Kidney Cancer Association for inviting me to share my story today.
Thank you.
So, as Radha mentioned, I was diagnosed with chromophobe renal cell carcinoma earlier this year. And actually, my journey really started late last year. In April of 2019, my husband and I got married, and we relocated to Washington, D.C. we relocated to Florida from Washington, D.C. And bought a house, and we were ready to, start a family in the fall. But I had some fertility issues. And so my tumor, like for many kidney cancer patients, was incidentally found during a series of ultrasounds and MRIs. I had experienced an ectopic pregnancy and underwent a salpingectomy, and then was subsequently diagnosed with fibroids and endometriosis. And so I underwent a myomectomy, and then I was diagnosed with cysts. So my tumor was found, and it was initially thought to be, it was found as a 4.2 centimeter mass, which they identified as, I think, which is a fairly common benign mass of the kidney called an angiomyolipoma. And, at the time I just thought, okay, I went onto the Google machine, I did a little bit of research. I was like, okay, I don't think this is something I really need to be concerned with. At this point, I hadn't made contact with a urologist because my tests were ordered by my GYN surgeon. But the only literature that I came across was that, masses, once they get over 4 centimeters, there's sometimes a risk of them rupturing. And there were some articles that suggested that pregnancy hormones could contribute to the growth of these masses. And so, still thinking our focus was going to be on getting pregnant, I thought, I better make an appointment with a urologist and just figure out if there's anything I need to do. So I went and I met with a urologist here in Florida. And I think, I was young, healthy, asymptomatic. He didn't have any reason to suspect it was anything but an angiomyolipoma. But he understood my concerns about the mass potentially rupturing and suggested that I have a CT scan just to get a little bit more information, and potentially have an interventional radiologist embolize the mass. And so on Christmas Eve, I had my CT scan done, and about a week later, I met with the urologist again, and he said, it's not an AML, it looks like it's a cyst, but I want you to get an MRI just to confirm that it's in fact a cyst. And so I think, once I heard that news, that was the first time that I thought, okay, maybe now I'm not focused on getting pregnant. I think that this is it could be something more serious. And so I think that's really when it became a reality that, that this was potentially going to be something more serious. And so I had an MRI done in January of this year, and the MRI report came back, and the radiologist identified the mass as a cancerous tumor. I think he identified it as either a translocation tumor or a papillary renal cell carcinoma. So, just doing some research online, that kind of left me with a sliding scale of what if scenarios and, questions really. So I received the call from my doctor at the end of January, and he said, I'm sorry, this isn't the call that you were expecting, but in fact, your mass is a cancerous tumor. And it was identified in the radiology report as either a translocation tumor or papillary renal cell carcinoma, which, just doing some research online, it left me with a sliding scale of what if scenarios and questions, based on that diagnosis. So, I remember it was like 5 o'clock on a Thursday when he called me, and there was wind blowing in the background on the phone, and I could tell that he just wanted to tell me the results and he wanted to get me off the phone. And I think when you get a diagnosis like cancer, when you hear it, like everything around you just freezes. Like the whole world just becomes silent, and like you're in this bubble. And I think it's a shock, because you're like, this can't be happening. Like I'm healthy, like I don't have any symptoms. And then when I hung up the phone and I'm like processing everything, I'm like, I thought to myself, and I think that this is important for doctors that are watching this to know. I think as humans, it's very easy for us to become desensitized to what we deal with on a daily basis, especially in our professional setting, in our professional settings. And so I think it's important for doctors to know that, like, that phone call that you're making, or that appointment that you have scheduled with a patient, like that is potentially, or is, one of the most stressful periods in that person's life. And what may be just another day in the office for you really it's a really big deal to that person. And so I think I wish at that time from my doctor that I don't necessarily think I expected empathy, but I certainly expected some type of compassion. He wasn't just calling to tell me I had a UTI. He was calling to tell me I had cancer at 34 years old. So I subsequently, I asked him, should I have a biopsy done? And he suggested that because I was young, that we should just go ahead and proceed with surgery. But because there was a risk of getting a false negative, but since my tumor was located deep within the collecting system, he couldn't give me a definitive answer whether or not the surgery could be done robotically or would require a full incision. And he also wasn't able to tell me whether or not he would be able to perform a partial nephrectomy, or if it would require a radical. So after I got the news, I took that weekend to kind of do some research and think about things. And I came across an article on the Cleveland Clinic's website that was written by a patient who was diagnosed with kidney cancer. She was close to my age, actually when she was pregnant. And the takeaway from her article was, really take a step back and don't rush decisions. And I remember at that time, like when you hear you have cancer, you want the tumor out yesterday. And so it countered every force in my body to take time and to get a second opinion. But my husband and I both discussed, and we decided that was the best thing for me to do. And so, having recently relocated to Florida from Washington, D.C., I decided to go back to Washington, D.C. and meet with a urologist that was recommended to me by a number of doctors in the area. And so I met with him. I traveled to D.C. in February, and I met with him, and I immediately thought he's going to want to schedule me for surgery right away. So I walked in, and he said, well, no, let's get a biopsy. And it took me aback, because it was total opposite of what the other urologists had told me. And I said, well, what about a false negative? And he said, well, no, there's no such thing as a false negative. He said, you're either going to get the pathology report will either come back as benign, cancer, undetermined, and the latter two will require surgery. He said, there's two reasons why I want you to get a biopsy. One, you're young. There's a 5 to 10% chance that this could be a fat poor angiomyolipoma, which is commonly misdiagnosed as cancer based on imaging alone. which I also learned that imaging alone is not diagnostic. He said, I would hate to partially or completely remove your kidney only to later determine that it was in fact benign. He said, on the other hand, if it is cancer, I want to know exactly what we're dealing with. That may, it will determine how I figure out your treatment plan and what type of surgery I may proceed with. So those reasons made complete sense. And so I stayed in DC for a couple of weeks, and I ended up getting a biopsy at the end of February. And about a week later, that's when my tumor was confirmed as, it wasn't confirmed actually, it was diagnosed as chromophobe renal cell carcinoma, which hadn't been mentioned to me previously.
So we're now heading into more of a time when COVID is in the atmosphere. People are aware of the pandemic. Things are changing. Can you talk a little bit about how the presence of COVID impacted your decision-making process?
Yeah. So I was officially diagnosed with the type of cancer I had in February, and my surgery was scheduled for March 31st. So between the time I got the pathology report to my surgery getting scheduled, I remember I scheduled it, like I made the appointment during the first week of March, and COVID was still kind of it was a new thing. It was kind of evolving. We really weren't sure of its true impact. And this particular surgeon worked out of 2 hospitals in DC. And then there were 2 days that he had the robot, one at each hospital. And so I was given the option to pick, and there was one hospital that I liked. And so I thought, well, I'd like to go to that one, but it's a week later. And I don't know what's going to happen with COVID. So let me pick the other hospital, which is also a great hospital as well. And I made that appointment, but it really was a tentative appointment, because in those weeks leading up to my surgery, I spoke to my surgeon several times a week, just getting an update on what the COVID situation was at the hospital. And at that time, it was hard to believe that cancer surgeries would ever be considered elective, but in some situations they were. And it wasn't until about 2 days. I mean, I remember my surgery was on a Tuesday. My surgeon called me on a Sunday, and he's asking me, do I want to proceed? And I'm like, well, and at the time, my husband and I had initially booked flights to DC, but because of COVID, we canceled them. And we drove 14 hours straight from Florida to DC to minimize our exposure. And so I was in DC, we were staying at a hotel down the street, and I said, well, we're here, like we're gonna. So, and in that same conversation, I asked him, because it wasn't just about, I mean, getting a cancer diagnosis is stressful to begin with. But when you have COVID on top of that, it just added a whole nother layer of stress and anxiety. And I was concerned about exposing myself to the virus. I was concerned about exposing my family, exposing, the medical team at the hospital. So it wasn't an easy decision to make. And I remember I asked my surgeon, I said, if this were you, based on all of the information that and the COVID situation and what you know about kidney cancer, what would you do? Would you proceed with surgery? And he said, I would. And I trusted him. And at this point, I had established a relationship with him. And so I thought, okay, like I want to go forward, because there was still a lot of uncertainty about the timeline of COVID. I mean, I don't think anyone ever thought it would be still happening right now. So I thought without having a definitive time period, of when this is going to be over. And then even then not knowing, what the surgical backlog will be for patients, or whether or not hospitals will have the supplies they need to perform surgeries. I knew mentally I couldn't go on with having the tumor in my body. Like I needed it out. Everything in my life had been put on hold. I, stopped looking for a job because I didn't think employers wouldn't want to hire somebody that's having to deal with cancer. Like, I stopped trying to get pregnant because I didn't, know what my future was going to be. I mean, even just like little things like making plans with friends and trips, and obviously COVID changed that, but I couldn't commit to anything in my life because I didn't know what my future was going to be. And that was really hard.
For sure. I know that cancer and surgery comes with a lot of physical ramifications. This was definitely compounded by the pandemic. Can you talk about how the pandemic environment impacted your emotional health and even your physical health, if it did?
Yeah, so I think, looking back on everything, the emotional part of cancer and COVID has been more challenging than the physical recovery. And just kind of looking back on even my stay at the hospital. So I had my surgery on a Tuesday, and I was told, and they were able to do it robotically, and he was able to perform a partial nephrectomy. And I was told, typically patients can go home in about, 2 days. Well, it was the day after my surgery. My catheter looked pretty clear. My Jackson Pratt drain bag looked good. So they thought, okay, you should be good to go. But once they removed my catheter and I started going to the bathroom on my own, that's when my urine changed to the color. It got a little red, and then it turned to, I think the medical term they used was red Kool-Aid. And so I think in maybe some situations that can be a little normal, but because of the COVID situation, my doctor recommended that I stay at the hospital because he didn't want me to have a complication and then be put into an emergency room situation where I'm sitting there with COVID patients. So I ended up staying in the hospital for about 5 days, and it was discovered that I had experienced 2 pseudo aneurysms in my renal artery, which were able to be treated by interventional radiology using some coil embolizations. But that extended period in the hospital was really challenging because I wasn't allowed to have my husband there. And you don't realize how important it is to have family members there until you don't have them. I mean, even just, I think it's recommended after you have a partial nephrectomy that to get up and start walking around. And I couldn't. I was in a lot of pain. I felt off balanced. And typically, I know my husband would have been there helping me, get some laps in around the hallway, but he wasn't. And so I used a walker to get around. And that's during COVID. So I was nervous about leaving my room. I was nervous about being exposed to, the invisible virus. I didn't know the staff coming in, taking my blood, checking my vitals, like if there was a risk that I was going to be exposed. I didn't know the food being delivered to my room, if I was going to somehow touch that and get exposed. I mean, there was still a lot we didn't know about the virus then. And when you're sitting in a room by yourself for days, you have a lot of time to think. And it was very hard. And so, the one thing that was great was one night I took my walker and I went over to my window, and I took my flashlight from my phone. I turned the lights off in my room and I shined the flashlight down from the window. And I told my husband what side of the hospital I was on, and he was able to find me on the 5th floor and wave to me and see me, which was really nice to see him. And then, when I got out, it was just great to see him and finally be reunited with your loved ones.
Can you talk a little bit about some of the anxiety and depression or anything that came from what sounds like a really, ultimately kind of solitary experience?
Yeah, so again, you know, like I mentioned earlier, I think the emotional part of this has been more challenging than the physical part, even with the complications. And, you know, we left Florida, I'm sorry, we left DC and we drove down to Richmond, Richmond, Virginia, where my parents live, and spent a couple of days with them, just so I could recover a little bit before we drove back to Florida. And we had brought my 13-year-old Basset Hound with us, Stella, and you know she was going to kind of be my recovery coach. And the day I got released from the hospital, my parents, we were about halfway down 95, and my husband said, you know, I need to tell you something about Stella, but I didn't want to tell you right away because you just got out of the hospital. And he said, you know, she's not doing well. And I said, oh, well, you know, sometimes she just doesn't feel well, but she'll be fine. And he said, no, your parents don't think that she's okay. And I got home and they had taken her to the emergency bed. And ironically, she had been diagnosed with a cancerous tumor in her stomach. And so, you know, for anyone that's had any type of major surgery, laying on the floor after that surgery probably isn't advisable. And but it's what I had to do. And so I laid down next to Stella, and so she was up. Sorry, she was up all night, and we had a vet come out the next day and put her down. But I was so upset. I was crying, and I was like hyperventilating, and I wasn't eating, and I worked myself into a fever of like 101.5. And I remember when my husband took my temperature, and I thought, my first thought was, oh my God, I have COVID, and I'm going to have to go back to the hospital. And, you know, I've just exposed my family, and it was stress. I was so upset. I had worked myself into a fever. So we buried Stella at my parents', and we came back down to Florida, and I had a follow-up telehealth visit with my surgeon via Zoom. And he, you know, looked at my incisions over our video conference, and everything looked great. I was feeling good. I was kind of getting back to normal. And I actually had a Zoom call with a new local urologist here in Florida, and everything was feeling great. And then a couple of days later, I woke up in the middle of the night. This was about a month after my surgery, and I couldn't go to the bathroom. And then when I finally was able to go to the bathroom, I was just passing like blood clots. And then my urine turned again to the color of red Kool-Aid, and my stomach sank, and I knew, oh my gosh, something's wrong. And I thought, I'm going to have another surgery. Like, this is my third bleed experience. So I went to the urologist that I had formed a relationship with here, which I would recommend to patients that do go out and get a second opinion, to always, you know, establish a relationship with a local urologist, just in case if you do have complications, you have somewhere where you can go and they know your history. So I got dropped off at the hospital because my husband again wasn't allowed to go with me, and was treated by interventional radiology again with some more coils to stop the pseudoaneurysm, and spent a couple of days there. And over the weekend, I was released on Friday. And over the weekend, you know, I was in some pain or discomfort from where they had ran the catheter through my groin, and they plugged it with something like it's called a minx, which is like they plug the artery and you swell from it. And I woke up in the middle of the night on Sunday. I couldn't breathe. I didn't know where I was. I was nauseous. I was dizzy. And I laid there until the morning. And And I called my doctor's office and spoke to the nurse, and I told her what was going on. And she said, well, it could be your blood pressure. So if you can get here safely, please come by. And so my husband took me back to the hospital, and they admitted me, ran tests, checked to make sure it wasn't my blood pressure, my vitals were good. It wasn't, I hadn't formed like a clot in my lungs or anything. And the physician's assistant came in later in the day, and he said, look, it's okay and it's normal, but I think you're just experiencing anxiety. And I remember thinking, like, how could I be anxious in my bed in the middle of the night? And that's when I realized, like, how much, as my mother-in-law would say, grief I had been through. And I didn't think it was grief. I just thought it was life, and, things happen. And I just kept going. But, between moving to a new city, looking for a job, getting a cancer diagnosis, having fertility issues, losing my best friend, like it was a lot. And I guess, and having the subsequent complications, I think my mind finally said, okay, we've had enough, and you can't just keep going. And so I think I would just tell other patients that, life is going to continue on even with cancer, and things are going to happen. And I think it's easy sometimes for people to just keep going and acting like everything is fine, which is what I did. But it's not healthy. And if I could do it again, and I wouldn't want to do it again, but if I could, I would, just help people be more aware of my emotional health and not neglect that. And, since my surgery, since my complications, I always try to stay ahead of any kind of anxious feelings I have. And that may be through exercise, through yoga, faith, a healthy diet, making sure I get enough sleep, whatever the formula is for people, because it makes a huge difference. And the reality is after you have a major health experience, especially when you're young and healthy, you become hyper aware and hypersensitive to anything that happens in your body. And, I was diagnosed with cancer when I felt completely fine. And so in a way I felt kind of lied to and cheated by my body, because I had no idea. And I'm so grateful that it was caught. Had I not had the ectopic pregnancy and subsequent issues, this wouldn't have been caught. And I think, my prognosis probably would have been very different potentially 5 years from now. So I'm very grateful for that. I just, I lost my train of thought. I'm grateful for that.
Yeah, it's a lot to handle, and we shouldn't and can't go through it alone. And it sounded like you had a couple of great sources of support and comfort during this experience. I would love to hear you talk a little bit more about what those were.
Yeah, and support is so important for patients. And I think unfortunately not everybody has a strong support system. And so I think for patients out there that have recently been diagnosed, it's important to find support. And if you don't have it, then reach out to organizations like the Kidney Cancer Association to get connected, with a patient advocate or somebody that can maybe help connect them with other kidney cancer patients. There certainly are a lot of resources out there. Smart Patients is one of them, which people can join. There's several social media groups, depending on what type of cancer you get diagnosed with. I always advise people, though, to be cautious with those, because every situation is different. And so it's very easy to get consumed with those blogs and threads, and it can contribute to your anxiety. So just be mindful when you're using them that everyone's situation is different. But for me, first and foremost, my husband, we had just gotten married, not even a year. It hasn't even been a year. And between the fertility issues and the cancer, I told him, I said, I promise you didn't marry a lemon. Like, it's, I don't know what's happening, but, you know, he was just really supportive, and he handled the ups and the downs like a rock star. And I mean, he drove 14 hours straight, you know, and he stayed in a hotel by himself for a week in DC while I recovered, and he couldn't see me. And I mean, those are things that you would do for anybody that you love, but it really, it meant a lot. And even just, I have close friends, like when I was traveling to DC for my doctor's appointments, they were picking me up. I was staying with them. I mean, just to have that support, it made a huge difference. One friend, she came with me to my doctor's appointment with the urologist in DC for the first time, and she was there with me when I was talking with him. I had another friend come with me and wait with my mom while I had my biopsy done. And so it meant a lot. And so friends and family and support is really important. And I think also when it comes to finding a doctor, it's important to number one, don't be afraid to be your own health advocate and advocate, you know, on behalf of yourself. Don't be afraid to ask questions, and don't be afraid to get a second opinion. You know, we shop around and we get multiple quotes and estimates for just a lot of things. And I think, you know, our health should be no different. You don't need to feel obligated to go with the doctor that diagnosed you. And, you know, when it comes to finding a doctor, I think it's finding the doctor that is experienced, but also genuine, and he or she, they're not trying to, you know, they're obviously very busy people, but they're not trying to rush you in and out of appointments, that you're able to establish you know, a rapport with them. And you know, I think finding doctors that encourage you to get a second opinion is very important. Because that's a good doctor that does that.
Yeah, it's really amazing how your doctor's demeanor can really influence your perspective on the whole experience from the start.
Absolutely.
Thank you so much, Megan, for sharing all of this with us. We're very grateful for your candor and for your insights on your experience going through this during a pandemic. There's a very detailed account of this on our blog if there's anyone interested in checking out the 3-part series where Megan dives into her journey in a lot more detail. So Megan, thank you again, and I will let you have the last word. Can you leave us with some final thoughts about going through kidney cancer during this pandemic?
Sure. Well, and again, thank you, Radha, and to everyone else at the Kidney Cancer Association. I think what the best way to probably close this out is well, one, as a patient, just being mindful of what is and what's not in your control as you're trying to process everything. You know, getting the type of cancer is obviously not in your control. Getting the type of cancer that you have is obviously not in your control. But once you have the information and you're equipped, you know, with the right information, that can be very empowering, and then you are in control with making the decisions that you need to make for your health. You know, with respect to COVID, I think, you know, I really sympathize for the patients that have had to postpone their treatment. You know, the pandemic has lasted a lot longer than anyone ever thought, and I know from experience that those patients are dealing with a tremendous amount of stress and anxiety right now. And it's really, really hard for them. But I think it's, you know, COVID has been a real stress test on our healthcare system. And so, you know, having panels like this and you know, getting medical professionals together to speak about the pandemic and what the experience has been for both them and the patient, is going to be a great way for us to learn from this experience and hopefully make the healthcare system more resilient for future disruptions, and also maybe improve the healthcare system. I think they're, the doctors can speak to that more than I can, but there have been instances where maybe some changes have been made that are actually better for the patient and the doctors.
Thanks, Megan.
Thank you.